Good morning. Welcome to today's CenterState CEO webinar, Understanding COVID-19 Vaccines, Treatment and Prevention. Thank you so much for your participation today. A huge thank you to our speakers for presenting today's webinar. My name is Kelly McLean and I'm with CenterState CEO. I'm a membership manager and I'll be your moderator for today's webinar. This webinar will cover informative discussion about COVID-19 vaccines and what you need to know about efficacy, availability, up-to-date vaccine-related insight from Dr. Fitzpatrick from BlueCross BlueShield and Dr. Procopio from Onondaga County Medical Society. Dr. Fitzpatrick is from the Medically Fragile Children Safety Net for Excellus Health Plan. Dr. Fitzpatrick is board certified in pediatric hematology oncology. She obtained her medical degree at Jacobs School of Medicine in Buffalo and continued her residency in pediatrics at the St. Louis Children's Hospital of Washington University in St. Louis. She then completed her fellowship in pediatric hematology oncology at St. Johns Hopkins University. While there, she participated in the graduate training program in clinical investigation at the Bloomberg School of Public Health. Dr. Fitzpatrick returned to Buffalo, where for 20 years she focused on caring for pediatric patients with brain tumors. As a medical director or the neuro-oncology program, she developed a comprehensive medical disciplinary team approach to care for these patients and their families. Her passion and expertise in caring for children with complex medical and developmental needs led her to also develop a comprehensive care model and program for her patients. She also has served as a chief division for pediatric medical education that led to the pediatric residency training program for many years in Buffalo. Dr. Procopio was born and raised in Baldwinsville, New York. He graduated from Baker High School in 2006. He went to Lemoyne College in 2010, and then on to the American University of Antigua College of Medicine in 2014. He completed his family medical residency in UHS in Johnson City in 2017. He's currently practicing as a family medical physician for the CNY group on Hinsdale Road in Camillus and serves on the Executive Council on Onondaga County Medical Society. He lives in Baldwinsville, New York. We're going to hand that over now to Dr. Fitzpatrick, but before we get started, just a few ground rules before we get rolling. Everyone will be muted the entire webinar. The program will be recorded, and if there's any questions, put them in the chat, and we'll have some Q&A after. And now I'll hand it over to Dr. Fitzpatrick.
All right, good morning, everyone. Can you hear me? All good? You're all muted. All right, good morning. We just wanted to take some time today to focus a little bit on the COVID-19 vaccines, just a little more update information about the vaccines, what we need to do, how to keep ourselves safe throughout this pandemic. I'm sure you all know that everything is really changing on an almost day-to-day, minute-to-minute basis with the COVID pandemic. So this is the most up-to-date we have as of this moment. But as I said, things will change every day. So I'm going to give you a bit of a clinical update and then some information about the vaccines and then some safety updates. I know you've opportunity to put things in chat to answer any questions afterwards. So just wanted to focus a little bit on, we've heard all these COVID surges and how much COVID is happening and when it's going on. So I just wanted to point out, this is from April back to April. So for the past year, and we had a peak around the holiday time, which came down nicely after the holidays. But I really want to focus everyone on this information here, which is that this COVID pandemic is not over, and it appears that we're going into another surge. We don't know how high this peak will go. This is where we all have the opportunity to make as many interventions as we can. But the data right now is certainly not showing that the numbers are going down. And this is upstate New York here, where we're really mirroring the national trends. COVID deaths, we do have some more information on how to manage COVID patients, what to do, some other tools once patients get COVID, how to manage them. So there is an overall decline in the deaths, but again, you'll see this huge surges here for COVID-19 deaths again, with the holidays, which we predicted as people got together and we're not social distancing. Upstate New York and New York State in general, as you'll see, we kind of see these little bumps and waves here, but every indication we have is that this is really accelerating and we're having some more increasing hospitalizations in the last few weeks. I'm based in Buffalo, and we've certainly seen an increased number of hospitalizations happening here in the Buffalo region, which is consistent with what we have throughout New York State. So this is just something to keep an eye on. And I know we're all in the middle of pandemic and COVID fatigue, but just a reminder that we still need to be vigilant, that we are not out of the woods yet when we look at these numbers. Hospitalizations, again, increasing here, hospitalizations upstate New York and nationally. You'll see some different states driving a lot of the trends with what's going on. And we'll get a little bit into the variants and what those are and how those might be adding to some of the surge that we have. Oops. So the COVID-19 variants, so we've only listed 4 of them here. There are probably hundreds, maybe even more that we just don't know about. So to identify the variants, it has to take an extensive lab test. So when you go in and get your usual, COVID testing, it doesn't tell if you have a variant or not. So we don't have information about everything. But what we do know is that this UK variant here, this B117, is really becoming predominant in Europe. As you see, if you saw the increases in Europe, they're ahead of us by about 3 weeks with really high numbers peaking again. But this variant here is really becoming predominant. You'll see information out of Michigan and other states where this is the predominant variant. South African variant is also less predominant here in the United States, but is here. So we want to be vigilant about watching for that. The Brazil variant, this one was interesting, I think, because in Brazil at the first wave, almost 70% of the population seemed to have COVID of some infection, and this variant seems to be reinfecting people as we go. So we'll wait and watch to get more information out of Brazil, but this is definitely not predominant in the United States yet. And I just put in a New York variant here to drive home that there are way more variants than this out there. The question is how to manage them. So we do think that these variants seem to spread more easily and quickly, which makes sense, right? This virus wants to survive, and if it can't spread, it's not going to do it. So when it's going to make mutations and that are going to be coming out, they're going to be ones to make it more easy to spread to different places. So this can lead to more infections, and certainly we're watching really closely to see if they are leading to more severe illness and deaths as we go. Scientists are really working to learn more about these variants. And if you follow the information on the CDC, they have these variants all categorized by how severe they are, and really looking to see if there's information about whether the currently authorized vaccines will protect us against these, will protect people against the variants. So we're keeping a really close eye on that information as it comes out. Given that the COVID situation is rapidly evolving, and if you're like me and you have notices coming onto your phone about COVID-19, you'll get dozens of updates per day that come through. So we really wanted to point you guys to the best information that we feel that there is. So for the information, the Centers for Disease Control, so the CDC, you'll hear this at many of the information meetings on TV. Updates, the Centers of Disease Control, this is the national governing agency that looks and is following the outbreak. New York State Department of Health for what's going on here in New York State, and our local county and health department. So if you can keep an eye on these as they change, it's the most effective and up-to-date health information that we have available. How do we stay safe here? So we really talk about this as what we call the Swiss cheese model of pandemic defense. So you see a piece of Swiss cheese, you can see all these different holes, and you want to make sure as the holes line up that you're not allowing virus or infection to spread through. So it really takes multiple layers of defense if you're talking about the Swiss cheese model to be able to prevent infections. And we get lots of questions, I'm vaccinated, am I safe? I'm social distancing, am I safe? So our answer is always that the more layers of defense that you can get, the safer that you are. And I know it sounds difficult, and we're all very tired from the pandemic. But again, if this is the virus over here and it's spreading through, you want it to hit some of these barriers that it won't be able to get through. So things like physically distancing, I'm trying to stay away from people, hand hygiene, cough etiquette, trying to avoid touching your face. You know, if you like me my children are older now, but even so, try to teach them, don't touch your face, don't touch your face, don't touch your face. It's difficult. It's crowded. Limit your time in crowded environments. I know all of us, me included, you know, if you're a very social being like I am, staying home is not easy. You want to get out and see people. Just be patient still. And then ventilation, outdoors, air filtration that you can go through to look at, government messaging and support that you can get for it. And then quarantining and isolation when you need to. So if your health department gets in touch with you and says quarantine or isolate, it really it's something that you have to do to not just protect yourself, but you want to protect your loved ones, you want to protect your community. And you'll see over here, there's been so much information about vaccines, and they're incredibly safe and effective, but they're just one part of our defense. So it takes all of these to do what we can to limit the exposure to COVID. And we've got only your own responsibilities here and shared responsibilities. So there's no one thing, including vaccines, that's completely perfect at preventing infection. You want to make sure that you add as many layers on as you possibly can. So these are the information on the vaccines that are currently authorized for use in the United States. And we update this slide multiple times a week, excuse me, about what's going on. So there's a lot of information here that I'm just going to share with you beyond that. So Pfizer vaccine you'll hear about. So this is a 2-dose series separated by 21 days. I'm going to really point you to the age indications here of age 16 and older. So this has already been approved for those who are 16 and older. So if you're the mother of a 17-year-old as I am, this was the vaccine I reached for as soon as my son became eligible. Eligibility opened up for all New Yorkers a couple weeks ago, and how to get them into it. So if you have a teenager, you really want to be looking at the Pfizer vaccine to do that when you're scheduling. Moderna is also a 2-dose series separated by 28 days. Age indications are 18 years of age and older. So that's something that you want to watch for. You know, you can't schedule your 17-year-old for the Moderna or the Johnson & Johnson vaccine. It's really just the Pfizer one that you can. Efficacy we put down here. You'll see these two are similar. I will say that this is not comparing apples to apples here. So all 3 of these vaccines are very effective. I'm sure everyone has heard, or many have heard already, that last week the Johnson & Johnson FDA put a pause on the use of the Johnson & Johnson vaccine as it appeared possibly to be connected to unusual type of blood clots that were occurring. So currently you should not be able to get or schedule the Johnson & Johnson vaccine, reach for the 2 Pfizer ones and Moderna for now. I do believe some information is going to be coming out in the next week or so about the decision to resume use of Johnson & Johnson or continue the pause. The advantage to the Johnson & Johnson is that it's just 1 dose. So we don't need to go back and get that 2nd dose in the series. More information will be coming out about that. That will be, I expect some more information by the end of the week, probably into the following week. But again, it's really important to just keep an eye out for that. And if you have questions about it, you can get some of the FDA and the CDC put a joint statement out, and always reach out to your own provider, your own doctor, if you have any questions about which vaccine is the best one for you. Why should you get the COVID-19 vaccine? We hear this all the time. You heard I'm a pediatrician, and we've heard all this information that children are safe and not getting COVID. But as more information is unfolding, we're finding out that that's not just not true. COVID-19 is very serious and can cause really severe medical complications and lead to death in some people. So we want to be very careful about that. Many of you are probably hearing more and more information about what we call COVID long haulers, people that have survived COVID and were infected, but have continued and lingering effects for it. The pediatric world is a little bit on edge too, looking at some effects that it may be having on heart and other issues that we have. So really, we do think that the best way to protect you from COVID-19 is to get the vaccine when it's available to you. Practice social distancing as much as you can. Continue to wear a mask. Number of masks is a option, but make sure it's a high quality mask if you're going to be wearing a mask. And there's different guidelines on the FDA and the CDC about how to do that. And then wash your hands often and thoroughly when you can. Your health insurance will cover the vaccine. It's provided at no cost to patients. The federal government pays for the vaccine, and health insurers cover the cost of administration of the vaccine. So this is a way to remove any barriers or possible barriers as far as administering the vaccine. You don't require a prescription for the vaccine. All you need is to get your appointment and your ID and to get your appointment. In New York State, we have some websites coming up for where how you schedule it. It's not the easiest process. It's getting easier now, but you really want to make sure that you have access to that or reach out to Access to Schedule if you can, and also bring your insurance card when you go for your appointment. That's most of the information that we have. I'm going to stop sharing screen and hand it off to my colleague here to continue, and then we'll be back for questions.
All right, well, thank you, Dr. Fitzpatrick. I appreciate that. A lot of this stuff will be kind of reiterating some of what Dr. Fitzpatrick said as well, but we'll kind of roll through everything. But we'll start off first with kind of introducing the Onondaga County Medical Society. So it's an organization. It's been around since 1806, which is very, very old, but very, very neat and cool. So it serves all the physicians in Central New York, so kind of the greater Syracuse area, and it kind of it provides a lot of kind of public health support and that sort of a thing for us as providers. I know throughout this pandemic, it did a lot to help with kind of setting up the video chats and giving resources to get PPE for physicians and offices and that sort of a thing. So it's kind of a very beneficial group, and it consists not only of us attending physicians, but there's also students, residents. We meet a few times a year and kind of just do the best we can to kind of improve the health of Central New York. So I guess next slide. So there's our nice symbol there. So here's kind of what Dr. Fitzpatrick was saying just a couple minutes ago, why vaccination is important. So really the biggest thing is because it works. So we know immunizations work well. If you just do a history over the last 100 years, there's things that I didn't see in residency training, especially pediatric illnesses that Dr. Fitzpatrick saw back when she trained, and I don't see them anymore because people are vaccinated. So things like measles, mumps, that sort of a thing. There used to be a lot of hospitalized kids on the pediatric wards back in the day, but again, when I was there, it was rare to have more than a couple kids down in the Binghamton area at a time. So we know for sure that vaccines do work. I know Dr. Fitzpatrick had kind of a similar slide to this, but even if you're immunized, you still have to kind of do proper hand hygiene, social distancing, wear your mask. I know obviously we're all exhausted and tired through this thing, but if you try to kind of think about others and think that if you do it, I mean, you're really helping out others, not just yourself, by doing these kind of precautions. So next slide, please. Perfect. So again, yeah, why should I get this vaccine? So again, why you should get it is because it works. I mean, vaccines work. They really help to kind of create a public health situation where we're not kind of in a crisis anymore, and you're saving kind of saving lives essentially, and preventing people from getting very, very sick and going to the hospital. I know that slide that showed the efficacy of the vaccines. So even though the Pfizer and Moderna are 94+% and the J&J is only kind of 66%, that's obviously important, but what do people care about? People care about, people don't necessarily care so much if they get the cold or if they get kind of flu-like symptoms, although you don't want to have flu-like symptoms if you can avoid it, but people care about going to the hospital or obviously being on a ventilator or worse, kind of dying. So the statistics that weren't necessarily there is that these are essentially 99+% effective of preventing you from being hospitalized and dying. So again, that's kind of the important reasons why you should get it. Next slide. So again, yeah, here's some key facts about it. So some of these are kind of interesting, and some of them kind of make me laugh in a way, but I like to kind of explain some of them. So again, like about getting vaccinated can help help prevent you from getting the severe illness. Even if you've already had COVID, there are reports of people getting reinfected. I mean, still, jury's not out there. Is it reactivation of your original infection, or did you get a variant, or did you get reinfected? It's hard to say. Again, a lot of this stuff is very early, as I know Dr. Fitzpatrick mentioned as well. So a lot of this stuff is subject to change. But yeah, I mean, even if you've already been sick, you should still get the vaccine to make sure that you're developing antibodies. And then COVID vaccines cannot give you COVID-19. So it would be very silly for us to develop a vaccine that gave you the illness it's trying to kind of prevent and defeat. So so again, the vaccines can't really give you the illness that they're made to prevent. And again, yeah, so the vaccines, so what the vaccines do is they create an immune response that your body can recognize the virus when you see it out in public. And the testing, what the antigens and the molecular tests do is they test for either viral RNA, so viral kind of genetic material, or just for viral proteins. And so the vaccine itself is not going to, it gives you the spike protein in your bloodstream, but it's not going to test in your nasopharyngeal swab. So just because you have the vaccine doesn't mean you'll test positive for COVID if you need to test. So next slide. Perfect. All right. So yeah, so how does it work, I guess? So yeah, so this is kind of stuff that I was a little bit talking about. So when you get a vaccine or an immunization, so essentially what it does is it needs to cause your body to formulate a response to the disease or to the illness. So in this case with COVID-19, it takes what's called the spike protein, which is the way that the virus gets into your cells to cause you to get sick and replicate. So what the vaccine does is it creates, it has your body. So in the Pfizer and the Moderna, it has your body create the spike protein. And then your body recognizes the spike protein and says, hey, this is foreign. So if it does see it in nature, you already have an immune response to prevent you from getting sick. And in the case of the J&J and the AstraZeneca and the adenovirus ones, is they use a different virus that kind of, a virus that can't infect you, that gets injected into you, that creates this protein. And that's what gives you the immune response. Next slide. So yeah, obviously with vaccines, this is where kind of our biggest challenge is in medicine, is trying to convince people that vaccines are safe and effective. The safety is obviously a huge priority for us. So in order for the emergency use authorization of these vaccines to be done, these viruses, or these vaccines had to undergo kind of rigorous testing, qualifications, that sort of a thing. So I know in both kind of the Pfizer and Moderna, there was 30,000, 40,000 kind of patients that volunteered to do the studies, and you need kind of to have a good study design where one group gets kind of a placebo and one group gets the actual vaccine. And then what you do is you compare data to see if anybody in the actual vaccine group had any severe adverse reactions or not. And through the testing, there really weren't too many. And now that we're a few months in, 4 months in, 4.5 months into giving the vaccine to the public, again, we really know that there hasn't been any major adverse events reported. And the way we know that is because we have this vaccine adverse event reporting system. And again, the CDC is closely monitoring this as we go along. So that's I mean, it just kind of shows how safe these vaccines are. Next slide. Perfect. So again, kind of what I was mentioning before. So again, you hear some of the counter arguments, and I've had patients come to me and they say, you know, it's kind of so new and that sort of a thing, and it's new technology and I just don't trust it yet. And again, fair enough. You want to always hear everybody's concerns, and we're not here to kind of fight or battle or debate necessarily. We're just here to kind of educate and see if we can get people to kind of see the science behind it. But so for the mRNA vaccines, these have been kind of, it's been a few decades of them studying it. So it's not like it's a brand new technology. These were kind of the first ones that I'm aware of that have been used for immunization. But the way it works, again, it sends kind of a blueprint into the cell. It's got these kind of lipid particles, so kind of like a fat layer around the blueprint so that it can adhere to the cell wall. It goes inside, if you guys remember high school biology and stuff, and it kind of uses these things called ribosomes, which help to translate it into the proteins. It releases the proteins, and these proteins go in your bloodstream, and your body recognizes that. It never goes actually into the DNA of your cell. It doesn't change the cells at all. It kind of just hijacks some of the peripheral tools that we have to make proteins. And then again, the viral vector uses a virus that can't infect you. The virus is not able to replicate or kind of infect you into your cells. So it kind of creates the protein itself and then releases that protein so that your body again can recognize it. Next slide. All right, perfect. So again, like I mentioned, yeah, will it alter your DNA? No. Again, the Pfizer and the Moderna use that mRNA, that blueprint that kind of hijacks a peripheral part of your cell to create the protein. So it doesn't actually go into your DNA. It does nothing to alter your DNA. And again, the J&J and some of the other viral vector ones, again, they don't do anything to change your body's DNA. Next slide. All right, is it safe to get a COVID vaccine if I'm pregnant or want to have a baby one day? So this is a great question. So this one hits close to home with me. So my wife actually was breastfeeding our son, and she got hers while breastfeeding. So, but yes, it's absolutely safe. As far as the data shows, there's really no reason to kind of have reservations about this. There's really no kind of mechanism that would cause a problem necessarily for babies, because really all you're doing is kind of creating antibodies. If anything, it's going to potentially give the child antibodies. So there really isn't any way that it really should cause any fertility problems or any problems with pregnancy at all. Next slide, please. All right, can a COVID vaccine make me sick with COVID-19? So again, very, very good question. The answer again is no, like I mentioned before. So vaccines, if a vaccine was going to give you the illness that it's trying to prevent, it wouldn't be a very good vaccine, because again, that's the point of vaccines, is to try to prevent you from getting that disease, because again, the disease could be potentially deadly. So no, it can't give you COVID-19. What it can give you is symptoms, which it's almost better to get symptoms, because it means that your body is creating an immune response. Obviously, you don't want to be kind of laid up for a few days and have a lot of body aches or anything like that from it. But again, it can't actually give you COVID-19. I mean, if that were the case, obviously we wouldn't give it, because we're trying to prevent people from getting COVID-19. I guess one more thing to say on this, because I'm not sure if it comes up later again. Yeah, with kind of the blood clotting thing, yeah, obviously that is a very concerning thing. And I think it goes to kind of show back on the safety stuff that, again, the CDC is reviewing all this stuff as we go along. If there is, heaven forbid, any chance that this can cause more harm than good, I mean, in medicine, that's kind of our oath, do no harm. So so if there's any chance that happens, we pause it. Again, in that case, I would anticipate that it's going to be, they're going to kind of deem that, hey, kind of these 6 cases are there, but 6 out of the 7 million, not necessarily a cause and effect, but there is something that we're going to have to monitor a little more closely with it. But I don't think there's any reason why they're not going to kind of resume those. But again, I think time will tell with that. Next slide, please. Again, so if you already had if you've already had COVID, you need the vaccine, like I mentioned before. Yeah, it's hard to say, or it's hard to know for sure. Are we getting reinfected? Is your virus reactivating? Who knows? I know Dr. Fitzpatrick kind of mentioned again with the long haul COVID, kind of these continuing symptoms that we see when we get illnesses. Again, it's not necessarily active virus replicating. At that point, it's your body's still responding, or your immune system's still responding for whatever reason. So again, honestly, just to be on the safe side, the more antibodies you can get, the better off you'll be. The caveats with that is again, you should get vaccinated if you're actively sick, having fevers, having symptoms from COVID. You should wait till it resolves, and usually we say a couple weeks in practice here. Next. Good. All right. Yeah. So do I have to get the second dose of the vaccine? So again, yeah, this is another kind of important question. If you look at the data, they do getting one shot does give you some level and a decent amount of level of immunity 7 to 10 days after the first dose. However, these were studied to be 2-dose shots. So in order to get full immunity from them, you absolutely do need to get the second one. Because again, it's just not going to work as well if you don't do that. Next slide, please. All right, what are the side effects? So again, yeah, the most common side effects of sore arm. I mean, that's with every vaccine. You're going to have some degree of a local reaction there, and it's usually just a sore arm. Fatigue and headache, definitely the headache is very common. I've heard a lot of patients kind of say that. And the fatigue, people saying they're run down, usually 12 to 24 hours, and it really doesn't last too long. Seasonal allergies, yeah, it really shouldn't have any bearing on the vaccine. And yeah, so this is kind of a thing that we'll get to for a point at the end. But yeah, if you've had allergic reactions to other vaccines, it is important to make sure you're monitored pretty closely. It really probably shouldn't prevent you from getting it necessarily, but it just means you're going to need a little extra monitoring if and when you do get the shot. Next slide, please. When am I fully vaccinated? Again, yeah, it takes some time. So again, for the 2-dose series, it's not until 2 weeks after the second dose that you're considered fully vaccinated. And then for the J&J, since it's 1 dose, 2 weeks afterward is when your body's kind of done that full immune response. You've got memory cells in your body that can fight off infection. And again, yeah, before that happens, I mean, obviously we urge you to keep doing all the proper things. So proper hand hygiene, social distancing, wearing your mask in public, all that good stuff. Even after you're kind of fully vaccinated, doing those to a degree, it's not going to hurt anybody. Again, I understand that people are very frustrated and fatigued from doing it. So, but again, those things are still important. Next slide, please. All right. Yeah, so what can you start to do? This is definitely, I think, going to change over the next couple of weeks here. So we'll see as more and more people get immunized, and hopefully we build up more and more of this herd immunity. Hopefully in the next few months, this whole kind of conversation will be a little bit moot with this question. But yeah, so as of right now, you can gather indoors with fully vaccinated people without wearing a mask or doing the social distancing, which is nice. You can go to places where there's unvaccinated people from just one other household. Without the masks, or staying 6 feet apart. But if any of those people live with anybody who has an increased risk of severe illness from COVID-19, probably not a good idea. And again, if you've been around somebody who's had COVID-19 and you're vaccinated, you're fully vaccinated, theoretically you should be protected from it. So you don't necessarily have to test yourself, but you should still monitor your symptoms, be smart about it if you do develop symptoms. Or if you work in a high risk field, if you're in healthcare and that sort of thing, it might not be a bad idea. But if you're fully vaccinated, you don't really have to worry about getting tested at that point. Next slide, please. All right. So yeah, so what should we keep doing even if you're fully vaccinated? So again, like we just went over, kind of those similar rules. Try to do the best you can. I mean, proper hand hygiene is probably something that should be a given. Pre-pandemic, post-pandemic, just forever. I mean, it's one of the tools we know without a doubt really does help prevent illness. Wearing your mask for now is probably a good thing. Really, again, going back to the people that might be allergic to shots, they might not be able to get a COVID vaccine, and heaven forbid you can give it to them even if you're vaccinated. We don't know if you can be a carrier or not, so we want to err on the side of caution, especially with a disease like this that can cause severe illness, and just keeping the social distancing as best you can. Next slide, please. Again, like I said, it's kind of just hitting on all those points again. I think some of this stuff is going to change. I think as we get more and more herd immunity, hopefully we can just be patient another few months here and we can convince enough people to start getting more and more herd immunity. But for now, still almost doing kind of similar precautions as what we have been. Again, the smaller gatherings are great. You can now get together with family if you're fortunate enough to have your family that's all vaccinated, or you're just seeing one other group of family members that may be unvaccinated at this point. Probably safe to do as long as you are fully vaccinated. Still kind of the larger size gatherings. I know for like athletic events and stuff, they're spacing people out pretty well, which is probably okay. Hopefully like concerts and that sort of stuff can can start getting back on track here. But for now, even if you've been fully vaccinated, it's still a good idea to kind of avoid those or limit them unless there are proper precautions in place. And again, wherever your place of employment is, they might have their rules, and no matter what, you still got to kind of follow those. Next slide, please. Okay, the travel obviously is a very, very important one. So now this is kind of good news for a fully vaccinated person. If you're traveling anywhere within the US, you no longer need to get tested before or after or do the self-quarantine. Again, masks still very important when you're kind of going to be in tight places where you'll be kind of right next to people. And again, it's not necessarily so much for you at this point if you're fully vaccinated. You just want to protect others. Again, heaven forbid you have something else, but it's also kind of to give solidarity to people that aren't vaccinated and kind of promote, hey, I'm wearing my mask. Hopefully you can wear yours as well. And kind of we can all get through this thing together. Yeah, being mindful of the transmission rates, the data that Dr. Fitzpatrick was showing at the beginning, it's very important to kind of keep an eye out for that. As rates go back up, if things really surge again, it's really going to be kind of strict going back to the restrictions that we've had for the last year or so, because it is important to try to keep those rates down so we don't overwhelm the healthcare system and that sort of a thing. Next slide, please. Again, yeah, why is it important everybody gets vaccinated? So I mentioned that term herd immunity before. So basically, what does herd immunity mean? So any of these kind of microorganisms, we can't see them. Again, it's kind of hard. It's kind of hard to kind of visualize, but because you can't see them directly. But these things float around, and kind of just going back to basic biology for survival, for these kind of microorganisms, they need a host. If they have ready hosts available, people that are unvaccinated, people that haven't had COVID yet, if they have readily available hosts, the virus is easily able to spread, mutate, cause these variants, cause all these problems. And again, so if it has that ability to do that, then the virus kind of sticks around longer. If we get enough people immunized and the virus and the microorganisms don't have hosts to kind of attach to, then the virus almost fizzles out. It's not like we kill it completely necessarily, but I mean, in some cases, viruses have been eradicated from vaccines and stuff, but it really is just the less hosts that are available, the less the virus is able to hold on. And then here's kind of a hugely important, this really can't be understated at all, and obviously important to everybody that we're talking here. So the barriers to vaccination. So again, people that have limited access to care, anybody that's been discriminated against, or any of the structural racism or any of the stuff that we have, unfortunately, that still goes on in the 21st century, is huge for us to try to overcome that, because really it's important to immunize everybody and get this available to everybody. So that is very important. Let's see, we got this kind of cool health equity task force, which they have a YouTube page you can check out. Or you can kind of direct people that might speak different languages to use that YouTube page to get more information on that sort of a thing. But again, that's very important. Next slide, please. All right, perfect. So again, yeah, so like I mentioned before, you might not want to risk yourself getting sick for a couple of days or being down and out for a weekend from getting a vaccine. Or, I mean, again, even bigger fears, like heaven forbid you have a bad reaction to the vaccine, one of these rare kind of 1 in a million things. Obviously, you don't want to put yourself at risk for that. But if you think about it on the flip side, again, you're not doing this for you only. You're doing it for obviously your family, your friends, coworkers, everybody around, all your loved ones. So again, the more people we can get vaccinated, the better off we'll all be. So again, it's very important to do that. Next slide, please. All right, so yeah, here's kind of my last take-home points on everything. So again, vaccines have been around for a long time. Again, like I said, in my training, I was lucky enough to not have to see such sick kids as all my mentors and attendings kind of would talk about, thankfully, due to vaccines. So again, we know they're safe, we know they're effective. It's not like they're throwing something out there that can cause harm to us. So again, it's just important that everybody knows that or understands that. Again, they're a great tool, as well as proper hand hygiene, social distancing, wearing your mask, all that stuff. This third one's kind of very important to me. I mean, we're all human. I always have to remind some of my patients that, and we get in some debates sometimes. but we all, I mean, respect each other. Again, if you have somebody that's really pushing back against it, I mean, if you're going to kind of fight or have a negative attitude towards it, they're just going to dig in more. It really isn't effective. So just kind of encouraging everybody to kind of stay educated and stay up to date with this stuff as best as you can. And just remember that we're all in this together. I mean, that's kind of hard. I think a lot of us get focused in our own little bubbles, and in a way the pandemic's created, actually we've been forced to live in our own bubbles. So, but just trying to remember that we're all, at the end of the day, we're all human beings. We all really want the same thing, and that's to kind of get back to some sense of normalcy. And really, I think the vaccine is a great tool for us to be able to do that. And then lastly, again, if you have any questions or concerns, you should always feel comfortable reaching out to your primary care physician. And they should really hopefully be available to you through this pandemic and give you answer to the best of their abilities. Because again, a lot of this stuff is changing kind of day by day, but that's what we're here for.
Great, thank you both so much for that really informative presentation. Just had a few questions. I'm not sure if either of you had touched on this, but how effective is the vaccine after the first dose?
I could take it. So the vaccines were trialed, the Pfizer and the Moderna vaccines were trialed to be 2-dose vaccines. We're getting some early data that it might be potentially in the 70% range effective after the first dose. But again, as Dr. Procopio said, you're really not considered fully vaccinated after the Pfizer and Moderna until it's 2 to 3 weeks after your second dose. So really go in and dose of the Pfizer and Moderna when you can.
Great. Is it true that both of your doses should be the same type, not one or one of the other?
Yes, absolutely. These weren't studied to kind of interact or cross over. They do have a similar mechanism of action. So it's interesting that people are understanding the concept of the vaccines, especially those mRNA ones, and understand that they use a similar mechanism of action. But no, it needs to be the same. If you get Pfizer first, you need Pfizer second. If you get Moderna first, you need Moderna second, because it just hasn't been studied to see if there's the booster effect with alternating them.
Right. I'm not sure if I think you may have started to touch on this, but isn't it true that you're more likely to get side effects after the second dose rather than feeling much after the first dose?
That's a good question. I'll let Fitzpatrick see if she knows any necessary specific data on it. Just from anecdotally from my practice, I don't think that that's necessarily always the case. I mean, maybe it really is hit or miss. You don't know until you kind of get it. There's no way of knowing until you get immunized. So I would say maybe, because the second one you are boosting, you're getting kind of that higher level response. That's why you're not fully vaccinated until you get the second one. So I guess perhaps theoretically, but I don't know of any data that proves that necessarily.
Yeah.
Do you, Dr. Fitzpatrick?
Yeah, no, I agree with that. And I think it's all anecdotal. I mean, I have 4 kids, 4 got vaccinated, and 4 had completely different reactions, from nothing to brutally sick after the first one. So it just depends. And I don't think we have enough information about that yet. I do think it's important to point out that if you're someone like me who got the vaccine and had almost no reaction to it, I'm still considered protected. And my daughter, who's 20, who got a vaccine and was really sick after her first one, she's protected. So we don't really know what the reaction to the vaccine means, except that we do know that the vaccine is poised to make your body respond to COVID if you see it.
Great. Can you kind of talk about how the vaccines don't actually have coronavirus in them?
Okay, yeah, I can kind of go back to what I was talking about before. So again, I mean, it's I guess it's hard to explain necessarily like too much into the science behind it, and so we like to kind of nerd out on the science of the whole thing. But I mean, it's not, you're not getting the actual virus. You're getting so again, in the mRNA ones, it's a blueprint that creates a protein that's found on the coronavirus, the COVID-19 virus, that is the way that virus gets into your cell and infects you. So you're really just having that protein can't make you sick. A single kind of protein can't make you sick because it doesn't have the virus material. It can't inject virus material into your cell to create more virus and cause you to get sick. So the mRNA ones for sure don't have one. The thing that might be confusing and scary about the adenovirus, the J&J one, which is probably the only one we should talk about since it's the only one that had the FDA EUA for and is now on hold. But that one is a different virus that's not coronavirus. It's an adenovirus, which causes a lot of common cold, that sort of a thing. Certain adenoviruses do, but the one they use in that case that cannot get you sick either, because again, it doesn't inject its DNA into your cells to create more virus to cause you to get sick. All it does is it kind of creates this protein, puts that protein out into your bloodstream, and your body recognizes that as foreign and allows you to develop immunity. But neither of them can have any way of making you sick.
Well, I appreciate both of you for taking the time to kind of go through all the science behind this and explain your experience and share with us all the information. It's really great. Really, really appreciate it. One of the questions is it true that the vaccine only lasts for 6 months?
I think, that's a great question. I think we're all wondering the same thing. So you have to remember these vaccines have only been tried for about a year in the initial testing. So the good news is those of you who got the vaccine when it was out in the general public, we've got all the people that participated in the clinical trials before. So they're being studied constantly to see how long they're immune for. I don't know if we can tell it'll only be 6 months. We know at least it's 6 months. It'll probably be longer. But I do think that most people expect that we'll need to get a booster at some point also to make sure that we continue to be immune to the virus. What that will mean and what it'll look like, I don't think we know yet, but we still have to get more information as it goes along about that. Only time will tell.
Great. Well, thank you again, Dr. Fitzpatrick and Dr. Procopio, for the time that you've taken to sit with us and teach us all of the things about COVID-19 vaccines. And everybody who has taken the time to join the webinar, thank you.